So the order's in, so you just need to await the call for MRI to get it scheduled. I asked that they do it off-site so you don't have to deal with a hospital.
Okay.
So, we discussed MRI to map fibroids, determine best route of surgery. We discussed typical overnight stay for laparoscopic, 1, sometimes 2 nights for abdominal. Discussed low risk of cold pregnancy, and worked up pre-op to include PAP, endometrial biopsy, and MRI. Next visit, review MRI, perform biopsy, planning procedure. I'm gonna include a little thing in here about endometrial biopsy so you know what it is in detail. And then your notes are all online, so as soon as I finish the note, you can read everything that I wrote.
Okay.
So I know Sarah was asking about filming or something, but you'll have access to everything in there.
Okay.
Would it be okay if I just felt your fibroids?
Oh yeah, go for it.
Yeah.
You feel them. You want to just lay down or just sit here?
Just laying down because your belly muscle will be more relaxed.
The last doctor told me it's like I'm 20 weeks pregnant.
Oh, okay, very good.
And so they should be, and they're cramping a little bit today. They're doing their thing.
And 1 second. Part of this being motorized is it's not particularly fast.
You need a zero gravity mode. You know, with the massage chairs that kick your
Oh,
legs up and
yeah.
back at the same time.
There's only a way to like crank you up really fast. There's no way to do whatever you just said. So I just like fiddle around with this pedal until I find what I want. Do you have a belly button ring at some point?
No.
Okay. Yep. Okay, so if these two are pedunculated, it's just going to matter where those other ones are and how deep they are.
Got it.
Because I can lop not to be crude, but I can lop those big ones off.
Yeah.
Laparoscopically, no problem.
Yeah. What's healing time of a traditional myomectomy?
4 weeks. And with laparoscopic, I also tell people 4 weeks. So, yeah. It just depends on the individual.
The movement will be a little difficult.
It may, but I will tell you that I'm not, for the most part, not doing an incision like this.
Yeah, it's this way.
Yeah, but most of the time I'm only.
Okay.
Yeah, I'm not doing the whole, that you would do for a C-section, especially if I can just, again, not to be crude, but I feel like your understanding of medicine is pretty good for somebody outside of medicine. If I can do a small incision, then if I can grab the fibroid and pull it to my incision, then I can detach it
keep it going.
and then keep going. And I'm just working, because I don't need to explore your colon.
Got it.
I just need to be able to see to remove them. So when I say abdominal, I mean, I'm a minimally invasive surgeon, so I do it in the most minimal incision I can possibly get away with. So usually about 6 centimeters, right at the hairline. So the recovery, I think when people are getting an abdominal myomectomy, maybe they're getting something like this or something really wide.
I think they're just wider. Yeah, what I
really don't like big incisions.
Fantastic.
So even if we have to do that, please rest assured that I will keep it as small as possible.
That's cool.
And
but you feel how big they are?
Yeah, but those are the big guys that are coming off the top.
Well, what's fascinating to me is this happened in a year and a half.
Yeah.
It wasn't until right before COVID that I can feel them. Like it's almost as if they get inflamed.
Yeah.
I'll go for it. You're good, Matt. Like they get inflamed. I mean, the fact that they push up my uterus is like amazing. But the fact that I'm not in a whole lot of pain most days is also amazing.
The pedunculated is encouraging.
Okay.
Yeah. So good for you.
Yeah.
So so let's
There are two that you can feel.
There's
this
one over to the right and
right
then
here.
one smaller one sort of right here. If you push harder, not too hard, but
you're fine.
Just like roll your fingers.
Lumps and bumps. You hit it. I feel you hit it.
Very good. So orders are in. We'll do lab work closer to the date.
Alrighty.
And we can make this all work with your moving timeline. Awesome.
Yeah.
And if not, please rest assured that I will make sure that you get somebody who's a specialist where you are. are. I'm very optimistic that we'll be able to do it, especially if you're flexible with your coach.
Yeah. Just point of transparency, because I've had just fibroids grow, I've not been as active, and I lost weight that I was like, this is annoying me a lot. How helpful is it that I lose additional weight? Is
Yes.
it, I mean, as far as, okay,
Yes.
I would always think so, as far as.
Totally. Prehabilitation is the like new sexy word for like optimizing your health before
Yeah.
surgery. From an anesthesia perspective, we know that there are cardiopulmonary changes for folks that are overweight or obese or not at their ideal body weight. And so it can limit the steepness of Trendelenburg that's needed for the surgery.
Yeah.
It can make the surgery impossible to do laparoscopically
Wow.
and has to be converted to open. So like anything that you can do to optimize your health before surgery, do it.
Okay.
By no means are you, is your current body weight like of extreme concern to
Yeah.
me, because it's
Yeah.
not. But if you're already looking to do that, it can only help your intra-op and your post-op recovery,
Got it.
because you're going to get back to your feet faster if your body's used to kicking in its metabolism and healing and making sure everything's well oxygenated
Yeah.
and everything else.
Yeah. Thinking about diet concerns, I know there's some research that says you eat these things, don't eat these things, and impact it. Is there anything else I could do? Again, prepare in the preparation process. Things I should avoid. I do know that gluten, my body expands even further, and I feel like it agitates what's already there.
Yeah. Eating a healthy, balanced diet, being physically active.
I'm at 70% plant-based at this point, so I'm not sure
Perfect,
what
better
else.
than me. It's really hard to get my husband, who's from Arkansas, to like go veg
My
only.
boyfriend's from Bama. I
Yeah.
wouldn't even try.
He's like, I want a steak. I'm like, really?
Yeah. Matt's a former football player, so I feel like he's
Yeah.
good.
Yeah. So we do
6'4",
tofu every
yeah.
Wednesday.
Okay.
My 5-year-old calls it toe food, like toe food. And he's like, I want toe food. And I'm like, that's gross, but we're gonna do it anyways.
Alright.
All right, awesome. Well, it was great to meet you.
You as well. Is everybody get the codes for this to make sure my insurance is gonna cover everything?
Let me just look up what it is.
Because that's something I've been thinking about too, making sure that it'll be covered by.
It usually is, especially because you're symptomatic. It's not, and I'm not writing infertility in there. I'm just writing they're causing you bulk symptoms. You've been trying to, interested in future fertility.
Yeah.
I'm not saying, oh yeah, it's, sometimes they get sticky about infertility, but I didn't write that in there.
Okay.
As a concern. Okay, so, oh shoot, where is it? CPT.
And even for the MRI, if you have it. I don't know if I see
So
these things
it'll be a
back there.
diagnosis code, and that is D21.9
D21.9.
is the diagnosis code for that.
Okay.
And why is my eye not catching myomectomy?
I've looked on the website for a while and I've been able to find it.
Abdominal myomectomy would be 58146.
58146.
And laparoscopic myomectomy
58146.
greater than 250 grams. CPT 58546.
58546. Okay.
All right. Awesome.